Good afternoon, this is Britt from DHS. Just wanted to let everyone know that we'll get started in about 2 minutes. Thank you. All right, good afternoon and welcome everyone to our final meeting, the final public meeting for 2019 for electronic visit verification. Today we wanted to provide some updates on EVV implementation and also hopefully address some frequently asked questions that we've received from providers and caregivers. Just some general housekeeping, all phone lines are muted as usual, and that questions should be submitted through the chat feature within the webinar, and we will address as many questions as possible at the conclusion of this presentation. So just a little bit of background. I know that we've covered this before, but Section 12,006 of the 21st Century Cures Act requires all states to implement the use of EVV for Medicaid-funded personal care and home health care services that require an in-home visit. So this is a federal mandate and states are required to do this, and if they do not, there are financial implications. So Pennsylvania could face a reduction in our federal funding if we do not meet these requirements. Again, EVV must be implemented for personal care services or PCS by January 1st, 2020, and for home health care services by January 1st, 2023. Given the upcoming date of January 1st, 2020, as we've mentioned previously, we are right now focusing solely on personal care services and EVV implementation related to that. So the Cures Act also includes a provision that allows states to delay implementation of EVV for up to 1 year if they can demonstrate they have made a good faith effort to comply. So Pennsylvania has applied for the good faith effort exemption through CMS. We submitted that request on November 25th of this year. If approved by CMS, this will allow providers additional time to use EVV without impact to provider payments. But we want to make sure that this is very clear that providers are still expected to implement an EVV system by January 1st, 2020. So our request to CMS is not to delay the use of EVV, but it is to extend the time before provider payments are denied for lack of EVV data. And just a quick update that there were 47 states, including Pennsylvania, that have applied for the good faith effort exemption, and CMS generally responds within 30 days of the submission, and we are still waiting on our response from CMS. As soon as we do receive a response, we will make sure that that is communicated out through the appropriate listservs and through other various mechanisms. So we will be sure and get that out to you as soon as we have any word back from CMS. We also wanted to make sure that we had sent out a clarification that we received from CMS regarding IVR technology. And this is related directly to telephony. So telephonic verification must include validation through a GPS or location system. We want to make it clear that cell phones are not acceptable for telephonic verification unless a location device code is included. So fixed voice over internet protocol, or VoIP, is acceptable because it does include that location, but non-fixed VoIP will require a location device code. We've had a number of questions come in through the resource account related to the FAQ document stating that cell phones can be used. And we are updating the existing FAQs to make sure that this is clearer. That original FAQ was based on our previous understanding of what was accepted, and now we are updating it according to the CMS clarification. We also want to make sure that, related to this technology, that providers are aware that they must ensure the EVV system being used by their caregivers meets the federal requirements, which includes the capture of location. So manual entries should be done on an exception basis only, and in situations when all electronic options are unavailable. And while manual entries are accepted, they should never be the primary source of visit capture information. Supporting hard copy documentation should be kept for any and all manual entries. And EVV compliance as they relate to manual edits is still being discussed internally, and we will share updates in the future through the release of a bulletin. So another update is that edits for the ODP fee-for-service went into effect for claims submitted beginning November 1st, 2019, for dates of service November 1st, 2019 and after. Additionally, edits for the OLTL fee-for-service went into effect for claims submitted beginning December 13th, 2019 for dates of service November 1st, 2019 and after. We wanted to make you aware that the error service codes for fee-for-service are available on the DHS EVV website and have also been sent out via listserv communications. We've included the link directly there to our website where you can find the error status codes document, and you'll see that within that error status codes document that we have the ESC code, the description, why the ESC is setting, as well as the resolution activity. And that's all outlined within that document. So the ESCs are numbers 925 through 931. And we want to make sure that you understand that those are specifically EVV edits. They are not HCSIS codes. So providers should not be adjusting claims based on these EVV edits. Any paid status claims needing corrections should be voided and then resubmitted. I want to make sure that you understand that EVV claims inquiries should be made to the appropriate program office for assistance. And we've listed out here the ODP claims resolution section with their 800 number, as well as their hours of operation, as well as the OLTL provider call center with their 800 number and hours of operation. If there is an EVV system issue, then you should contact the PAC line, and that is 800-248-2152, or you can email them at papac1@dxc.com. So for providers, we want to make sure that you understand that it is your responsibility to train staff and also provide assistance to employees that are having difficulty using EVV. Additionally, providers should be capturing and verifying EVV data. You should be doing this now if you are able to. Providers need to review their remittance advice to monitor claims to identify issues that need to be addressed, and visit exceptions need to be resolved by the provider. Additionally, providers in ODP-based services should also review their ODP files to identify issues that need addressed. And this is very important. We want to make it clear that providers should not be entering training data or dummy data into the EVV system. You should only be entering production data EVV visits. There is online self-paced training available 24/7 for providers that are using the DHS EVV system to see how the system works and to see the appropriate steps to take in capturing EVV visits or making edits in the portal for administrative staff. The DHS EVV webpage includes videos as well of the DHS EVV mobile application and the telephony to demo the visit capture methods as well. So there are two additional ways that you can see how the systems work without actually doing dummy data into the system. We wanted to once again go through what personal care services are. We've outlined these, in previous presentations, and we also have these on the DHS EVV website. But once again, when we're talking about personal care services, we're talking about those that are under the Office of Developmental Programs, or ODP, the Consolidated Personal Family Directed Support Waiver, and Community Living Waivers, and the Intellectual Disabilities Autism-Based Services. And within that, it is companion, in-home and community support, respite in unlicensed settings only, and homemaker. Also under ODP, we have the Adult Autism Waiver, and those services are community support and respite in unlicensed settings only. Then under the Office of Long-Term Living Waivers, we have personal assistance services, participant-directed community supports, and respite in unlicensed settings only. We wanted to once again outline what we mean by fee-for-service programs versus CHC. So just breaking it down once again, when we're talking about fee-for-service programs, or FFS, we're talking about within ODP, it's a Consolidated Person Family Directed Support Waiver and Community Living Waivers and Intellectual Disabilities Autism-Based Services, as well as the Adult Autism Waiver. And fee-for-service programs on our OLTL consist of the OBRA waiver and Act 150 program. And then separate from that is the CHC program, which includes Community Health Choices 1915C waiver. So for questions on whether a provider or services are included in the EVV mandate, please contact the provider enrollment. And we've listed out here the ODP provider enrollment number, as well as the email and the OLTL provider enrollment number as well. So just to once again mention that we are working with an open model for our EVV system, and the department is working with DXC and SanData to develop an EVV system that integrates with Promise, our existing Medicaid management information system. Providers under an open model may use their own EVV system or alternate EVV system, but those systems need to capture the 6 required items under the 21st Century Cures Act and will need to meet DHS system data requirements to integrate with the DHS aggregator. The technical specifications can be found on the DHS EVV website, and we've included the links there. We want to make sure that you understand that the DHS aggregator does not submit claims. When an EVV service is on the claims transaction, the claim is validated against EVV visit data in the DHS aggregator. And billing processes should continue as normal. We wanted to mention that we will be reviewing how to use the DHS SANDATA EVV billing module, which can generate an 837, and that will be discussed later in this presentation for those providers with a web BBS account that want to use this feature. So again, for ODP providers that are fee-for-service providers, we've listed out again those waivers that are included as fee-for-service. And the DHS SANDATA EVV system is available for those fee-for-service providers who do not have their own alternate EVV system. Fee-for-service providers choosing to use an alternate EVV system will need to work with SANDATA to get their system certified and to receive production credentials. The participant-directed services under ODP, PALCO will be using an alternate EVV system called Authenticare, and ODP continues to work on this and will communicate out additional information once it is available to share. Under OLTL providers, the fee-for-service programs, again, are OBRA waiver and Act 150 program. And the DHS aggregator will receive information from alternate EVV systems being used by providers in the fee-for-service programs, similar to those under ODP. And providers that are intending to use an alternate EVV system need to contact SANDATA at the number listed here, 855-705-2407, to complete alternate EVV integration activities. So also under OLTL, we have to talk about CHC. Current CHC providers and aging, attendant care, and independence waiver providers. For those, the 3 CHC managed care organizations, or the CHC MCOs, are utilizing HHA Exchange for their EVV system. Providers using alternate EVV systems within CHC will need to send their EVV data to the CHC MCOs. And those providers should contact HHA Exchange at edisupport@hhaexchange.com to complete third-party system integration activities for CHC. Any questions about HHA Exchange should be directed to the CHC MCOs. Participant-directed services under OLTL. As we mentioned previously, OLTL's Vendor Fiscal Agent Public Partnerships LLC, or PPL, is using an alternate EVV system, or Time for Care. This system is already integrated with PPL's timesheet and payment system, as well as their participant and direct care worker online portals. And that training on that system began in August. Now, we just wanted to walk through a little bit more on alternate EVV. We can't state it enough that providers that are using an alternate EVV system need to be working with SANDATA, their alternate EVV support team, in order to be certified and integrate with the DHS aggregator. The contact information, as mentioned previously, is the 800 number, 855-705-2407. We also have an email of paaltevv@sandata.com. But we wanted to note that the certification process can take up to several weeks, depending on the testing required. And providers already working with SANDATA do not need to reach back out to SANDATA again. So this slide just shows the process that exists for the alt EVV certification, and the reason that it can take up to several weeks, because the provider makes the request to SANDATA alt EVV support via email or phone. The provider then receives the alt EVV system information. The provider takes alt EVV training on the SANDATA aggregator via Learning Management System, or LMS. The provider then requests testing credentials. The provider then works with SANdata to conduct testing and assist with any issues or errors encountered. The provider then identifies go-live date and requests production credentials. The next step is that the provider confirms the live date or live data is in the SANdata aggregator. And then there's the end step is that the provider all EVV is completed. So right now we have 138 alternate EVV systems that are currently being tested. 21 have completed testing, and 37 alternate EVV systems have credentials and are currently in production. So again, who needs credentials for the DHS aggregator? A provider supporting only CHC MCO participants using the HHA exchange system does not need credentials. A provider supporting only fee-for-service participants, that provider would need credentials if they are using an EVV system or they're using the SANdata portal login. A provider supporting both CHC, MCO, and fee-for-service participants, they would not require credentials if all visit data is captured via the HHA exchange system. However, they would require credentials if visit data is captured in multiple systems. The alternate EVV aggregator training is not mandatory for CHC MCO providers using HHA exchange only. It's also CHC providers and aging attendant care and independence waiver providers electing to use the HHA exchange EVV system by the CHC MCOs must work with the CHC MCOs to complete training and other onboarding requirements. So just an update, alternate EVV testing and duration. The SANdata alternate EVV system is available for testing at all times, except during standard release windows. SANdata can assist with testing results and validation. Participant matching will not be included as part of testing, but will be enforced in production. Duration of testing varies from 1 week to 4 weeks, and testing should continue until the data sent is error-free. Once testing is complete, SANdata encourages the move into production as quickly as possible. And right now, the mandatory use date is January 1st, 2020. And just a note again, if you are intending to use the alternate EVV system and SANdata's EVV system, you need to let SANdata know that when you reach out to the support team. The DHS SANdata EVV system self-paced training is available for providers electing to use the DHS SANdata system for OBRA, Act 150, and ODP programs. Providers using the DHS SANdata EVV system must complete this training in order to begin setting up their agency accounts and security permissions. Another clarification that the DHS SANdata EVV system is only available for fee-for-service providers. The webinar and classroom training for the system has concluded. However, as mentioned previously, the self-paced online training is still available for any new providers or those providers wanting to take refresher courses. We currently have 907 actual individuals that have completed the training, and you can use this for staff to train through the self-paced online format. We've included the registration link there to the SANdata Learning Management System, so you can go in and register and take the training in that fashion. To date, 428 provider agencies have completed training and received welcome kits. The DHS SANdata EVV welcome kits Just a note that due to the upcoming holidays, any agency completing training on or after December 20th, that's this Friday, will not be guaranteed a welcome kit by January 1st, 2020. And again, there's a link for the learning management system to access it. We wanted to remind you that when you are enrolling for the training, please be sure to use only your 9-digit agency Medicaid provider identification. It is important to note the following items inhibit and delay reporting and welcome kits when providers use inaccurate MPI numbers, use more or less than 9 digits in the MPI field, and use faux MPI numbers. So please do not use 11111 or 1234567. The welcome kit that is generated and then emailed out contains the following information. It's an encrypted welcome letter containing important next steps and instructions for using EVV, including agency-specific login credentials, such as the URL, username, and temporary password in order to access the SANDATA EVV database. The login credentials contained in the welcome kit will also allow the agency to input their direct care workers, as well as set up additional agency-level staff to view and manage EVV data. 2 agency-specific call reference guides containing Santrax toll-free phones are also included in the welcome kit email. So one is for group visits, and the other call reference guide is for non-group visits. The call reference guides contain step-by-step instructions to direct care workers on how to check in and out using the telephonic visit verification. The other item that is included in the welcome kit email is the service list. So for the welcome kit distribution, while multiple provider representatives from the same agency may complete the DHS SANDATA EVV training, the welcome kit email will be emailed to the first identified provider agency representative email address on the training registration and completion reports. When agencies receive their welcome kit emails, they should begin to enter direct care workers into SANDATA EVV, add agency EVV users, and become familiar with training documents and train employees. Partial contents of the welcome kit email are encrypted, and when the welcome kit email is sent by SANDATA, the recipient will have 10 days to open the email. Once that email is opened, the recipient will have 10 minutes to access the code in order to open the secure contents. It is important to open the welcome kit email timely in order to avoid requesting it to be resent. If you are a fee-for-service provider and completed training but have yet to receive a welcome kit for your agency, please contact the PAC line at 800-248-2152 or papac1@dxc.com. Just a reminder that you should check your spam or junk folders because sometimes the welcome kit can end up in that. And if the welcome kit has expired, also call the PAC line, use the EVV prompt in order to get the welcome kit resent. At this point, I'll turn things over to John from SANDATA to go through scheduling and billing.
Good afternoon. Thanks, Britt. Today I wanted to walk through the new modules that will be enabled within the SANDATA system, the billing and scheduling module, which work together in conjunction to provide some abilities for the agencies using the SANDATA system to schedule staff in the field to provide services, and secondarily follow up those captured visits with the generation of an 837 file. The slides today are just an overview. It's a very high level, but just to get the team in this group familiar with how the functionality lays out, the simple steps it takes to create a schedule and then to create a bill, ultimately create an 837 that you can submit for payment. But I do encourage you, so I wanted to start. SANDATA will make available the training modules. These are self-paced modules through the SANDATA learning system, and we encourage all providers to take a look at them. The scheduling and billing sections, as I mentioned, are intended to work hand in hand to allow, one, your caregivers more efficiency in the field when they're selecting who they're providing services to for which service code, but then ultimately create a visit based on the electronically captured visit information. So we want to start with an overview. So if we can go to the next slide, we'll talk a little bit about scheduling, we'll talk a little bit about billing, and then we'll go through a little workflow and some screenshots that may help you get familiarized with the features and functionalities built into the system. So the scheduling module will start first. This is an optional component based on the PADHS program implementation. But some of the highlights from a scheduling perspective is, one, it allows the individual agency to assign care workers in advance when you know there are services that need to be repeated or recurring on a specific schedule. It can allow you to schedule that and better manage your staff as you go forward. It also simplifies the point of entry when a caregiver is in the field and they are attempting, or they're going to provide service to an individual. The schedule allows them to do a one-click after login and secure and mobile connect to capture that point in time from a visit capture perspective. Another enhancement or another feature is that it allows you visibility into visits that were performed when there wasn't a schedule available. So in those instances where service needed to be provided and there wasn't a schedule, the agency can determine when and why that occurred. And it also allows you to measure utilization. So from a utilization perspective, you can manage and help verify that your care workers are providing service to the right individuals at the right time based on your staffing level and the needs of your memberships. It also helps to enforce that I have an authorization for that particular service at the time of visit collection and not after the service has been delivered. Next slide. From a billing perspective, what the billing module does is it works in conjunction with the scheduling module. And for those agencies that are going to take advantage of the billing module, the scheduling module also becomes mandatory. And as we get into billing, I'll talk to why that's a requirement. But the scheduling feeds the billing component, and it allows the provider agency to generate an 837 specifically based on the electronic visit data that was captured at the time of visit. It ensures that that payer only pays for the actual time that was rendered based on the service rules or the billing rounding rules implemented for your particular payer office. The claim verifies the length is authorized prior to submitting to the adjudication system. So what that means is it will roll up the units and ensure that the data that is captured at the time of visit aligns to and matches what was captured. So when the Promise system makes its call out for claims processing, it has a valid visit to match and will reduce the number of errors and or rejections from a claims perspective. Claims that fall, yep, perfect, thanks. Nope, go to the next slide. So we're going to start with scheduling from a workflow perspective. And there's a couple things to note here. We're going to talk through the slides as if we were using both claims and billing. So scheduling would be mandatory in this case, and we're going to schedule for all of our visits. So in order to do scheduling, we're going to start by clicking on the scheduling link. We're going to create a schedule for a particular member or client in the field. We'd like to do schedules one day ahead of time, if not more ahead of time if it's a recurring schedule. And I'll circle back to that when we get to billing, just from an update perspective. But we'll select an existing member with an authorization record that has a valid Medicaid ID. The Medicaid ID for the member and the authorization record are both sourced and sent to the SAN-Data system via the PADHS source systems. So we're in alignment with their systems when authorizations are issued. We make the schedule active and we save and close that schedule. On the next screen, I'm going to show you a screenshot of where that information is captured. So here, if you look at the left side of the screen, we have the menu selection in the left pane. And then as we work down the page, we're going to first select the member, as I mentioned. The service code based on the membership will only show the services authorized based on the inbound authorization file. So we select the service for that particular member. We set the date and time for the schedule that we want it to occur. And then once those are linked, you will see the authorization record pulled into that schedule. This provides you a snapshot of a single entry from a scheduling perspective. And then we're going to click the Create Preview screen or button there at the bottom of the screen. Next slide. The Create Preview appears at the bottom of the screen, and it shows you a summary of the schedule that you've just created. So on December 11th, for this system integration testing member, we've added service code W7061 to begin at 9 a.m. and end at 9 o'clock. So two things can occur at this point in time. We can save the record for a single visit that would have occurred on December 11th, or we can save it as a recurring schedule. The recurring schedule allows us to schedule out over a period of time, or potentially over the period of units that are available for that authorization for those services that require a recurring schedule. Recurring schedules would allow me to set Monday through Friday, Monday, Wednesday, Friday, or whatever combinations of day and number of units that were available for a particular visit. Once that recurring schedule is set, that stays in the system for the duration of time that was set based on the schedule. Each individual schedule can be adjusted after that, and there's more details in that when you go through the training modules. Next slide. We've created a schedule. The caregiver's been in the field and they've collected EVV data. Now I want to circle back and create the invoice for that particular event. As I mentioned before, the schedule has to be created in the past because the billing module doesn't allow for same-day billing. So billing becomes available for all visits that occurred prior to yesterday. So anything that was historical up to yesterday. So if I was billing today, anything from December 17th backwards would be available for billing. But in order to generate an invoice, I need to do two things. One, we've already corrected any exceptions that may have occurred with the EVV visits. We have we've captured all the valid cures, data elements, and we have a verified visit for those using the SANdata system. Next, we're going to do what we call invoice creation or create invoice. What the create invoice function does was allow us to move the record from a verified state to a billable state. And in order to do that, we're going to use the billing link within the menu options. We're going to select the create invoice option. We're going to next find those items that are billable. And in order to do that, we're going to select a date range that we're looking for. We're going to click a checkbox called Show Only Items Okay to Bill. What that does is it limits the search to only those visits that have been verified within the SANdata system, and we're going to click Search. From there, we'll see a list of eligible visit data that are able to ultimately able to generate an 837. The next couple of screens, or the next two screens, I'm going to show you what that looks like from an application perspective. But ultimately, you're going to click the Create Invoice button, and you'll receive a pop-up that says Creating Invoices, and you'll receive a confirmation when that is complete. Once it's complete, you can click OK and move to step 2. But before we get to step 2, let me just show you a quick screenshot of what Create Invoice looks like. So here I've selected the date range December 1st through December 12th. I've clicked the OK to Bill item, which is in the third row over on the right-hand side, and I click the Search button. And in this case, I have the single record that I showed you previously where we'd set up the schedule. And from here, in the top right-hand side of the column, I'm going to simply click the Create Invoice button. What that does again, and there's more information in the training, is move it from a confirmed state to a billable state for that particular record. Next slide. Now, to submit an invoice, from a submit invoice perspective in the SAN data terminology, this is where we're going to generate the 837. So we've created a schedule, we've collected EVV data in the field, we've verified that information, we've created our invoice, moved this to a billable status. Now I want to group individual records to create an 837 or a claim file that I can send to Promise. You're going to select the menu option for Submit Invoice. From here, you're going to select a single payer. What Promise, the rules for claim submission state that I can only send a claim for a single payer, so either the ODP population or the OLTL population. Again, I'm going to check the checkbox of Show Only Billable Items because I only want those items that I've created an invoice for and that are ready to bill. I'm going to click the Search button. The search button then shows us all of the records that will be available for that particular claims file that will be made available in the 837. I'm then going to click the Submit Invoices button. Here's the key. A pop-up at that point in time will show up for those web BBS agencies that have a submitter ID to upload claims via the web interface. You'll enter your submitter ID. That submitter ID is unique to you so that you can download your receipt or your remittance for that individual claim. You're able to track those via the portal where you do those things today. So you're going to enter that submitter ID. The pop-up screen will appear each time you generate a claim, but you'll only be required to enter your submitter ID one time. So you enter that, and once you click OK, you're going to have the option of downloading the file. When you get the pop-up for downloading the file, you want to click OK, and it makes it the 837 available to your local computer where you can upload it through the web interface. So the next screen is going to show you a couple screenshots for how that interaction works. So as I mentioned, I clicked the Submit Invoices button on the menu option on the left-hand side. I selected my payer first. I checked my Select Billable Items checkbox, and then I hit Search. After search, as I mentioned, you'll see the record that's available to be billed, and it's pretty small print, but if you see in there, the status is now billable rather than confirmed. So now I have a billable record. And the top screen, you also have the file name. So it shows you the EDI file transaction name that will be generated, which is your Promise formatted 837 file. I'm going to click the Submit Invoices button to generate that claim. Next slide. So now that I've clicked on the Submit Invoices button, here's where the pop-up appears that I mentioned before. Enter your agency submitter ID. This is again the web BBS ID that was provided to you for those that are using that web interface to upload your systems. The process of submitting claims does not change. So you're generating the file from the 837 file from the SAN data system, but your process to upload and submit to Promise remains the same. But we do need that agency ID so that you're able to track your transactions as they go through the system. Next slide. Here's the confirmed download. So at this point in time, you want to hit OK because it makes the claim file for one or more records that you've selected to include in your claims file will be downloaded and available to your local system, again, for upload into the Promise system. Next slide. And then historically, claims fall into what we call the submitted bucket. So on the menu items under the billing module, there's submitted items. you're able to select a payer and a date range, and it will show you all of the claims that you submitted or generated from the SAN data system. And clicking on the file name actually shows you the 837 that was generated. This does not track payment of claim. That will still come from your existing processes to track and download transaction files. But this will show you the raw or generated 837 claims information that could be used to submit to Promise. Quick reminder, and Britt had mentioned this earlier, your DHS EVV account is live data. We should only use it for live information. So from a training perspective, and for those that want to take advantage of scheduling and billing in combination as additional enhancements or features for your agency, I encourage you to go out and take the training. It's available on the SAN Data web portal, available now. It's repeatable. You can use it multiple times, but it gives you an in-depth overview in more detail than we provided here, the specifics around scheduling and more details around generation of claims or using the billing module.
Thanks, John. So we also wanted to update everyone that is using the DHS SAN Data EVV system to let you know that the missing member issue has been resolved. If you are unable to see a member still, please contact PAC. Again, that number and the email is included there. Additional contact information, we wanted to be very clear about this. For DHS SAN Data EVV application questions, please contact the PAC line, either via the 800 number or the email address included here. For DHS aggregator issues, those also should be reported to the PAC line. For general program questions, those should be directed to the resource account, and that is ra-pwevvnotice@pa.gov. And then we also wanted to just make everyone aware that we do have a new link for the DHS EVV website. So if you had that marked as a favorite previously, you will need to update that in order to access the information. We have a screenshot of what it looks like now. And additional EVV communications will be posted to this website and will also be sent out through the existing listservs. So with that, we'll move on to questions that have been submitted through the chat feature. And just give us 1 minute to go through some of these, and we'll be right back with you. Okay, we've had a number of questions regarding the good faith effort exemption, and wanted to just make it clear that this applies when we're talking about providers that are expected to implement EVV system by January 1st, 2020. We are talking about both fee-for-service and CHC providers. And again, the request that we've submitted to CMS is not to delay the use of EVV, but to extend the time before provider payments are denied for lack of EVV data.
So we did receive a few questions about welcome kits. So there was one question about whether welcome kits are just for providers using the SAN Data EVV system, and that is correct. You will only receive a welcome kit if you are choosing to use the DHS SAN Data EVV system as your EVV solution and you completed training. We also received a request for a welcome kit from someone stating that they completed training. So we will follow up with you individually and send your email to Sandata's customer care line, but we also encourage you to reach out to them as well to request the enrollment kit or the welcome kit and notify them that you had not received it. Okay, so we have another question here, and I think we either need additional clarification from this provider or we'll need to follow up with you directly offline. So this question here regarding that a provider who has tried to load their patients or their participants into this Sandata EVV system, and they were told that their patients or participants are not eligible to be uploaded since they are only currently uploading OBRA waiver participants. So for the OLTL program, if you are providing services to individuals in the aging, attendant care, or independence waiver, imagine these are the participants that you're unable to upload, you are not able to upload them into Sandata. We are not implementing EVV for the aging, attendant care, and independence waiver in the fee-for-service environment because you're moving to CHC. So really what you need to be doing with those participants is working with the 3 managed care organizations under Community Health Choices so that when they move out of the aging, independence, and attendant care waivers to Community Health Choices on January 1st, you're able to either use the MCO's EVV system, HHA Exchange, or integrate a system with them that you have chosen to use. But just remember, the Sandata EVV system provided by the Department of Human Services is only for fee-for-service participants. So these participants, once they move into Community Health Choices, cannot have EVV through the DHS Sandata system. You'll have to work with the MCOs for that process. So there's been a couple questions about the location device codes we were discussing in relation to using IVR technology. So as we discussed before, IVR technology used to call in a visit can be used with a fixed VoIP service or a landline telephone that is associated with an address. If you are using a cell phone or a mobile VoIP service with that IVR technology to call in EVV visits, you have to have another way of verifying the location. And when we're mentioning that type of location code, we're simply citing technology that is available through certain systems that allow a fixed verification device to generate a location code as part of that call-in. That is not a device that is available through the Sandata DHS system, but we are aware that many EVV systems that are operating across the state do offer that technology. So we were just citing that as an example of one way you could verify the location using a cell phone and IVR technology to call in a visit, but we do not have those devices to issue. If you please bear with us, we're just consolidating additional questions we're receiving.
John, we have a number of questions for SANdata. I'm going to give you the first one, that no client phone numbers are in SANdata. All telephony visits show as incomplete and listed as an exception. Providers cannot correct this, correct?
Incorrect. You can actually add an alternate phone for a member that will allow you to associate that member, to Kristen's point, that physical fixed landline device at the member's home. You can associate that phone number, and if the call in originates from that phone number, it will associate with that individual member.
So another question we have here for you, John, is how far in the future can we make recurring schedules?
It's unlimited. The portion that's what scheduling does from a benefit perspective is it doesn't allow you to schedule more time than units are available within the authorization scenario. I have 100 units. I do 2 units per day. I could do 100 days worth of visits, as an example. But the scheduling does limit you based on the number of units that have been authorized for that person, but it can go into the future for as long as needed.
So we've received questions related to billing as well. Is there a way to delete a billing that is entered incorrectly as in an error by a new user? There is a functionality within the SANdata billing module to roll back the creation of an X12 if there's something that needs to be updated on the visit data in the EVV portal. But given that this is talking about deleting a billing, if the claim has actually been submitted to BES and is in a paid status, that claim needs to be voided and resubmitted, and there's functionality within SANdata that supports voids and resubmissions. For those who are unfamiliar with the concept of an 837 file, it is a professional claim file type, essentially. We've also received multiple feedback from providers indicating that they are experiencing continued issues with seeing all of their participant data in the SANdata EVV portal. If you are a provider agency that falls into that situation and you do not have an open ticket with SANdata that's being researched, please contact the PAC line so that a ticket can be created and the Tier 3 team can support the resolution of that issue. So we received a question just requesting that we confirm if a provider is using an alternate EVV system and they are sending EVV data to the DHS aggregator, will that be validated as part of the billing process? And that is correct. So if you are using an alternate EVV system and you bill through Promise, you will send your EVV data to the DHS aggregator, and that will bounce up against promise claims to validate the claims were submitted with the appropriate units matching supporting EVV visit data. We were getting requests on whether or not staff are permitted to use consumer cell phones for clocking in. That is permitted as long as the participant allows you to do so. So we have another question here as to whether or not whether or not units are verified against claims, and they are. So the EVV visit calculates the equivalent number of units for that service, and it is expected that they match the claims submitted. And then the other note to this question is that units are not visible to providers who are using the SANdata portal. So the units that are calculated when the time is submitted are visible in the SANdata EVV system, but they are calculated automatically based on how that time was entered. For clarification, the billing and scheduling submodules within the DHS EVV solution, which were demonstrated through this meeting, are available to those who are using the DHS EVV solution. It's not available if you're exclusively using an alternate EVV system. We've received a question on whether or not DHS is aware of the status of all EVV vendors and getting their testing completed and getting certified with the SANdata aggregator. We do receive updates on the progress of our alternate EVV providers, so we are aware of the progress being made and when you're starting testing, when you achieve the completion of your testing, as well as receive production credentials. So that is the answer. John, this is a question that came up previously, and it's now coming through the public meeting as well. So SANdata had previously informed a provider that their only way to capture visit verification is a voice or signature, and they're concerned about ADA violations.
So from a SANdata perspective, the capture of client verification of services, and verification of signature is disabled, and that's not included. The Alt EVV specification does allow for client verification to be sent in, but it's not required. So from a PADHS program perspective, the client verification information is not required for a visit.
And just an additional note on that, because we received another question regarding the requirement for an electronic signature from a participant at the end of a visit. So we have chosen not to enable a requirement for a signature from participants through the EVV system because program rules and policies are different across programs, and multiple program offices are implementing the DHS EVV system. And our goal is to satisfy EVV requirements established by the Centers for Medicare and Medicaid Services. However, if there are other policies in the programs you serve, whether it's the Office of Developmental Programs or the Office of Long-Term Living, that require some sort of evidence and documentation for a signature, those rules do not change. EVV does not override any other policies that you need to satisfy for the program office that you provide services through. So there's a question here regarding a provider who is using HHA Exchange for their EVV solution, and they were asking if they should be able to see their members in their portal now. You'll have to work with HHA Exchange and the managed care organizations to troubleshoot any issues you're having with the system and seeing your members. If they are members who are not yet transitioned to CHC because they are not moving to CHC until January 1st, 2020, you would not be able to see them now. But if they are actively in Community Health Choices at this time, you should work with the MCOs and HHA Exchange to troubleshoot why you can't see them. We're getting questions about where the authorization data is coming from in SANDATA, if it needs to be, who enters that information. It comes directly from the HCSIS care plan system for fee-for-service authorization.
But I mean,
questions are coming in regarding if approved, if the good faith exemption is approved, how long the grace period would be for claims to be denied. That's to be determined based upon the response they get from CMS. So DHS will be letting providers know the impacts once we have that finalized. John, here's a question for SANDATA. If a participant is picked up at a location not listed in the GPS SANDATA, will it still verify and process the service, or does location need changed or added?
it will still allow you to verify it. So location is just an indicator of where the service started, originated, and stopped. It's recorded, and it's not updatable after the fact. It is recorded in the system, and you can move that visit into a verified state.
So there's a question here regarding a provider who not only serves waiver participants through the Office of Developmental Programs and the Office of Long-Term Living, but they also serve private pay participants as well as participants through the Options Program, and they're requesting how they can include them in the PA-DHS SAN-DATA system. The PA-DHS SAN-DATA system has only been built to accommodate providers and participants in the programs mandated to use EVV under the 21st Century Cures Act. So we will not be adding any participants from outside programs if they have not been mandated to use EVV through that, that legislation.
Hi, we are getting a lot of questions about vendor fiscal for participant directive services for ODP and our provider with Palco. Currently, we are still working through some issues with the vendor fiscal and the agreement, and so more information will be coming forward as we go along. We will not. It will not be sprung on providers like last minute or anything. We still have to provide a training schedule for our providers. So we will give all consumers and individuals who are participate in the vendor fiscal model ample time to ramp up and to make sure they're comfortable with the EVV system before we implement it to the field. So just stay tuned. More information will be coming, and we'll provide that to the field once we have more information.
We have questions from our providers asking if we could elaborate a little bit more on how SAN-DATA supports the void and resubmission process if there's data incorrectly captured on the visit. Could you speak to that?
Absolutely. Again, I encourage everybody, the training is available, so go out and review that because it does take you through in depth. So from a void perspective, it works similar to other claims transactions, right? So you recreate the claim. When you're in the submitted state, you pull up the claim. You can go through the void step, which generates another 837 with a voided status that can be submitted to promise to void that claim. It then makes the visit information available to be billed again, quote unquote, billed again. So it puts that back into the queue. You can go through the steps, regenerate your 837 reclaim file, and upload it through BES. that was high level. And again, I encourage you to go into the training because it'll go through that in more detail and specifics on how you do that.
We have a provider who says they only have residential facilities, and how are my staff members expected to log in if there are 24-hour services provided? We bill by the day. Well, again, EVV is not, residential facilities are not subject to EVV ODP providers. So if you're a residential provider, licensed provider, EVV is not applicable. Okay, we have a question here. Will an assigned supports broker be able to assist in the training of EVV? For ODP, we do have supports brokers, and we expect that when we get the system with Palco, that supports brokers will be involved very heavily in helping train participants and consumers with EVV. So this is a dual, collaboration that we need to work together, and that sports brokers need to be aware of not just the Palco system for vendor fiscal participants and registered services, but they should probably be aware for all services that EVV systems that a consumer might use. So through the agency with choice models, there's going to be some other different types of EVV systems that could be used. And if you're a supports broker, you should be knowledgeable about those different systems as well.
So we received a question regarding services that start at one location, and it may be, a typical location that's already registered in the account, and then the service ends at an atypical location that maybe hadn't been registered in EVV before. So the question is whether or not a scenario like that would lead to any sort of penalties against the providers, and it will not. We will always allow services to be provided regardless of where they are, because we don't want to inhibit the provision of services in the community or a participant's ability to live their life and move around in the community. But if you do have that scenario, we encourage you to update and add the additional addresses as soon as possible. And in the SANDATA DHS system, as well as many other EVV systems, there's usually some sort of notes section when you're completing that visit. So that's another way for you to be able to add additional notification that this particular location is atypical and will need to be updated in the system.
If you're a provider agency that does not feel ready to be capturing production EVV visit data by January 1st, please send an email to the RA inbox for EVV. I believe that's in the slide deck as well. John, here's a question for SAN data. What should I do if dummy data has already been input into the SAN data system? Is there any way that I can negate it?
We have a couple options. You can call the PAC line and enter a support ticket that will get routed to the SAN data team, and we can take steps to quote unquote remove that information. You can also mark the records, any visit records, as omit, and any client entered data as inactive, so that they don't appear available for scheduling, billing, or any other associated activities after that.
So we received a question. I think there's a little bit of confusion regarding the discussion we were having earlier about IVR technology and the need to collect the location. So this question is in regards to whether or not the GPS used through a cell phone while using the SANdata mobile app is sufficient to collect the location information, or if they need to use some other device. If you are using the mobile application on a cell phone that does collect location, that is sufficient. We were really only talking about scenarios where something like a basic cell phone or a mobile VoIP service was being used without any means to collect a location.
We've got a couple requests on information on when the slide deck will be available. It will be published to the DHS EVV webpage. So that will be done as soon as, about 24 to 48 hours. We will have it updated and published on the website. So you'll be able to access it there at that time.
So we received a couple questions with concerns that a particular EVV system will not allow a second address to be added, and whether or not that is being corrected. Without knowing what EVV system you're using or referring to, we really can't answer the question. So if you would like to submit any additional information regarding, if you're using SANdata's EVV system, HHA Exchange, your own private EVV system, so that we can better address that question, that would be appreciated. Thank you.
Hi, we received a question, will additional training be done to help us understand how to correct claims that were billed incorrectly? So if you go to the EVV website, slide 8 was referencing it in the PowerPoint today. If you go to the EVV website, there is a document there called EVV Error Status Codes. And within that document, it talks about the code itself, the description of the code, why the error is setting, and recommended resolution activity. So that should hopefully be very helpful in terms of resolving any errors that you set during the validation process.
We're not going to answer it.
Hi, John. This is Janelle with DHS. I wanted to let you know that we have some other questions for SANDATA. First one is, what is the required data points for clients in the SANDATA system, such as date of birth?
Can you say that one more time, Janelle?
What are the
required
required
for clients?
the required data points for clients in the SANDATA system?
So the client information is coming from the PADHS source registration system, and there should be no additional required elements specific to the client. When you make a client active, there is an additional date of service or originating date of service when the member became eligible to receive services that needs to be set. So the base information should be coming from the system, and you should not have to add additional information at this point. When you do enable or make a member active, you do have to add that service date to allow you to provide service in the field and make them active.
So we received an additional question requesting clarification as to whether or not EVV is required if a provider is working only in community health choices. If you are in community health choices and you provide any of the services required to implement EVV, which includes personal assistance services, participant-directed community support, and respite in unlicensed settings, you are still required to use EVV. The only difference is instead of working with SANDATA, you need to work with the MCOs to ensure that you either are trained on their EVV system through HHA Exchange, or you are integrating your own EVV system so that you can send data to HHA Exchange. John, another question for SANDATA. They're asking why date of birth is not coming over from HCSIS. I don't know if this is an issue that we need to look into, or I'm just trying to follow up here. They're not seeing date of birth coming over for clients.
Yes. Yeah, so as part of the program design, it's not required in the claim, and it was a minimal necessity data element that was decided to not be included in the inbound data feed. Janelle, we should take that as a takeaway, and we can discuss adding that if that's a need for the agencies.
Okay, and here's another one. If the case manager has not added units to the care plan, you will not be able to collect / bill or schedule through SANDATA. Is that correct?
You would be able to generate a single schedule. You would be able to capture the visits. You would not be able to generate a bill because there's 0 units that are authorized at the time for service. So you would have to get the authorization, contact your care team or care plan representative to get the authorization updated. And once it flowed into the SANDATA system, you could then generate a claim for authorized units.
So a question we received is, how is the participant's cell phone number validated compared to an employee's cell phone number? We are not doing any sort of validation in regards to the ownership of the phone. You have the choice to use an employee's phone, a provider agency issued phone, a participant's phone if they give you permission to do so. But we are in no way validating whose phone it is, simply that the EVV visit information is correct.
Hi, we have a question. It is, how far in advance does the information from an alternate EVV system need to be sent to the aggregator before we can actually send billing data to Promise? Okay, so when you submit the transaction, the EVV transaction to the aggregator, you will receive a response. And if it's a positive response, then, after that, you can bill, because that would tell you that the data is in the aggregator. So that it's present during claims validation that occurs against the aggregator.
So we're getting questions regarding whether or not the state anticipates that claims would deny on January 1st. As we have communicated previously that error status codes were enabled and what the criteria is for them to set to pay and list status, we will similarly be notifying providers in advance when we would expect claims to switch to a deny or suspend status. So you will be notified in advance. John, here's a question that I think would be helpful if you help explain it. So it's talking about, in a circumstance where the participant eligibility information is not in SAN data system, they're asking if the visit can be uploaded to the aggregator. So from an alt EVV's perspective, my understanding is that we have a validation edit that if the participant data is not in our system and we're not showing that they're eligible, that the provider would receive an error message back, correct?
That is correct.
And that would be the provider's method of knowing that they'll have to resubmit that visit data for that member later once the eligibility information is in the system. So you keep sending it until it's accepted, essentially.
Until it's accepted. That's correct.
So there's just a question here regarding what system will be used for participant-directed employers and participants. So for Office of Long-Term Living Programs, PPL, or Public Partnerships, is using their system, Time for Care. And for Office of Developmental Program Waivers, PALCO will be using a system called Authenticare. And we are going to consolidate some additional questions we received, so please stay on the line. We're getting a couple of questions coming in from providers trying to voice technical issues that they're experiencing with the SANDATA solution. If you have not already contacted the Provider Assistance Center, please do so the ticket can be generated and research can be conducted by SANDATA and you can be followed up with. If you already have an open ticket, they will get back to you. There was a request to go back to the previous slide, which we just pulled up not that long ago, slide 52, with the DHS EVV website. So that is now available for viewing if you are trying to see the URL. So as we've gone through the presentation today, we showcased what the SANDATA DHS EVV billing module is going to look like and how you can utilize it. We will be notifying providers once that is enabled. It's not yet enabled at this time. We're continuing to receive additional questions, so please stay on the line as we consolidate them. John, we have a provider that's asking how long it typically takes to receive an alt-EVV file response.
It's a real-time web service, so you get the response in near real time. So depending on connectivity, it's a matter of seconds to receive that response error back with any either positive or negative results based on the processing.
John, the provider's asking how the response comes back, like if it's an email, if it's a memo, notification somehow, what does the response look like?
So the response is a formatted JSON web service, just like the API interface is, and it has an error message embedded in it that the service would need to look for investigation of error. Back to the example in the presentation, no member found would be an error where the Medicaid ID for the member that was passed, but then the request did not match the data that was provided by PADHS, and the error message says no client match. The support team on the SANdata side can work with each individual agency to provide that list of errors and help guide you through how to receive and respond to those errors and how to correct the information.
John, another question coming in from providers about visit maintenance. Is there a limitation or a time period in which a provider has to correct a visit within visit maintenance? So how long?
So from a visit maintenance is available at any time for any visit, but I strongly recommend that you use any of the billing practices that you need to submit a verified visit from a timely filing perspective. So visit will stay in an unverified state until action is taken. But again, you should work with your program offices on any timely filing rules from a claim submission perspective so that you don't impact the need to get a reimbursement.
John, here's another question that we're hoping SANdata can answer. For an alt-EVV system, is HCSIS or any other program being used to verify client data? Providers indicating that they're consistently receiving error messages stating that their client is not found.
So I'd have to know a little bit more in detail on what's being passed in the specific scenarios. So if we get more information from that submitter, then I can do some investigation and guide them on next steps. Also ask if they have submitted any tickets. If I could receive that information, then I can provide some direction.
All right, thank you. So we did receive a question regarding if there is a limit to the amount of manual fixes that can be done to EVV visits before they are flagged for some sort of auditing process. So we will eventually be releasing requirements on outlining manual visit expectations for the percentage of visits that can be manually edited. And that will be issued in a joint Office of Long-Term Living and Office of Developmental Programs bulletin. So please keep your eyes out for that here in 2020. That will be released as soon as possible, but it is not yet finalized.
John, on the all EVV response that's submitted through the JSON process, will the response list multiple members as being accepted or rejected?
It will. So there's a process that can, each independent member record will be evaluated for success or failure. And if you send in 199 passed, 99 would get successes and 1 would receive the error message in that instance.
All right, we just wanted to say thank you so much for joining today's webinar. The presentation and the recording will be made available on the DHS EVV website. We hope to have that available by the end of this week, if not very early next week. And again, thank you and happy holidays to everyone.